Hey everybody, it's Dr. Peebler. I've been getting a lot of feedback and people seem to really like the hospital rant videos. So I decided to do kind of a offshoot of that as a office rant video. So I'm in the office today seeing patients and this week happens to be a week that has a lot of issues with weight and insulin resistance and diabetes and things like that. And obviously that's a big problem for our country right now is diabetes and obesity, and how those are not only risk factors for cardiovascular disease, stroke, etc., but also for things like COVID, and how that kind of ties into back, what we've been talking about over the last several weeks and months about COVID and its risk factors. And I was totally going to do a video on vitamin C and quercetin and how it relates to COVID, kind of in the same format as I was doing the zinc and the vitamin D videos. But I was really kind of disheartened to see that there just wasn't a lot of robust literature for me to present to you guys. I didn't feel like that was going to be useful. I mean, there's a lot of literature that shows that vitamin C has helped with all kinds of things from sepsis to common cold and other things like that, flus. But there wasn't a lot of literature with vitamin C and COVID in particular, so I decided to skip that. And like I said, with the newfound interest, or I should say feedback that I've been getting from people regarding my videos, and on top of that, just all the patients I see in the hospital and also in the clinic setting, of people who with diabetes, obesity, insulin resistance, etc. I've decided that's kind of the direction I want to go. In particular, there was a gentleman that reached out to me named William. He's in Pennsylvania, I believe, and I unfortunately couldn't take him or his wife on as patients because unfortunately the way the medical licensures and whatnot, I have to have a license in every state in order to take you on as a patient, and I don't have a license in Pennsylvania, unfortunately, so that was kind of a sad thing. But that being said, I do want to try to make videos that can potentially help both of those two guys, those two people, and countless other people, and talking about the real drivers of disease, what my mentor calls the four horsemen, which would be insulin resistance, catabolic physiology, excesses in cortisol, oxidative stress, and chronic inflammation. So I think I may start one of the first videos out on just insulin resistance. What is it? How is it bad? Why is it bad? How to quantify how bad it is, and then what it can lead to. Not only diabetes and that diagnosis, which is terrible in itself, but also the things that, kind of come after diabetes, which are, microvascular and macrovascular complications, such as, foot ulcerations and problems with your eyes, kidneys, etc. But more kind of like bigger picture things like heart attacks and strokes, which no one wants to have. So insulin resistance, obesity, medicine, those are all things that I have to definitely see and care for, and not only in my private practice here in Florida, but also when I'm in the hospital. So just wanted to give a shout out to William and his wife, and just let you know that I do want to put some videos that are going to help both of you guys, and then if anybody else who has those issues and struggling with those issues can benefit, I'm happy to help provide that information. So hope you guys are all having a good week, and take care.